International Men's Health Week, 2025, Closing the Empathy Gap. Observed annually in the week leading up to Father's Day, International Men's Health Week serves as a critical opportunity to highlight the health challenges faced by men and boys worldwide. In 2025, the week falls between June 9th and June 15th, with the central theme, Closing the Empathy Gap. This isn't just a catchphrase, it is a call to action to address the long-standing emotional, social, and clinical neglect of men's health. Despite significant advances in medical technology and global health initiatives, men continue to lag behind women in life expectancy and face higher risks of chronic diseases, substance abuse, and suicide. The problem isn't just medical, it's deeply cultural. Men are often taught to tough it out, to remain stoic in the face of pain, and to avoid expressing vulnerability. This has created an empathy gap, where society underestimates, ignores, or misunderstands men's health needs. In this video, we will explore the key issues affecting men's health in 2025. The relevance of empathy in healthcare delivery, the impact of the empathy gap on mental health and chronic illness, and practical strategies to foster a healthier future for men. All right, folks, let's dive into an important topic, understanding the men's health crisis. Men are, unfortunately, at a disproportionately higher risk for many serious health problems. According to the World Health Organization, men die an average of 5 years earlier than women. 80% of sudden cardiac deaths occur in men. And, men are less likely to seek preventive care or regular health checkups. It's also quite concerning that suicide rates in men are 3 to 4 times higher than in women globally. This isn't due to biology alone, though. Men's reluctance to seek medical help is often rooted in social conditioning. Boys are often taught to man up, don't cry, and deal with it. These messages, reinforced through media, peer pressure, and even parenting, discourage emotional expression and delay healthcare intervention. Men also face a higher burden of occupational hazards, often working in physically demanding high-risk industries like construction, mining, and transport. Lifestyle habits such as smoking, alcohol consumption, and poor diet contribute further to the burden of disease. The empathy gap refers to the lack of understanding, concern, and emotional responsiveness to men's health challenges, both by society and within the healthcare system. Some symptoms of the empathy gap include 1. Stereotyping male patients as being uninterested in their health. 1. Underdiagnosis of mental health issues in men. And 1. Healthcare messaging that primarily targets women or general populations, excluding male-specific concerns. This lack of empathy not only delays care but also contributes to a growing sense of isolation among men. One of the most overlooked dimensions of men's health is mental well-being. Key facts. Men account for 75% of all suicides in many Western and Asian countries. They are less likely to be diagnosed with depression, despite having high rates of substance abuse and burnout. Men in rural areas, especially in India and Africa, face compounded risks due to poor access to healthcare and mental health stigma. In India, for example, a 2024 study by AIMS found that only 3 in 10 men with depression actively seek treatment. Men are more likely to express mental distress through anger, violence, substance use, or withdrawal, which often gets misread or ignored by healthcare providers. The empathy gap in mental health is deadly. Men often receive less emotional support from peers, partners, and even professionals, who may dismiss or fail to recognize their suffering. In 2025, the leading physical health issues affecting men include cardiovascular disease, the leading cause of death among men. Contributing factors include smoking, poor diet, and high stress. Prostate and testicular cancer, awareness campaigns like Movember have helped, but routine screening is still low in countries like India, Pakistan, and Southeast Asia. Obesity and diabetes. men are less likely to seek nutrition counseling or weight management support. Liver disease, largely attributed to alcohol consumption and hepatitis infections, particularly in younger working males. And respiratory issues, common among men working in mining, construction, and industrial jobs without adequate protective gear. A 2025 survey by Pace Hospital in Hyderabad reported that 52% of men aged 40 and above had never undergone a full-body health checkup. The conversation around men's health is not limited to hospitals or clinics. It begins at home, schools, workplaces, and communities. What we must change: parenting practices, encouraging emotional openness in boys from a young age, educational programs, integrating gender-sensitive health education in schools, workplace wellness, offering mental health days, flexible work schedules, and employee counseling services, media responsibility, redefining masculinity in films, advertisements, and social media to include vulnerability, empathy, and health-seeking behavior. Governments and NGOs must also expand outreach through community health workers and mobile clinics in rural areas where health access for men is poorest. Training doctors and nurses in gender-sensitive communication, encouraging shared decision-making in treatment rather than paternalistic models, designing male-friendly clinics that respect privacy and minimize stigma, using masculine positive messaging like strong men, get checkups rather than guilt or fear, leveraging sports, workplaces, and male influencers to promote awareness. Embedding psychologists in general clinics, promoting peer-to-peer support groups and online therapy platforms tailored for men. Policy interventions can make a significant impact on men's health. For instance, incentivizing men to undergo preventive screenings through subsidies or employer-backed insurance can be a game-changer. Additionally, mandating workplace health audits and ensuring safe working conditions in male-dominated industries are crucial steps in the right direction. Digital health access is another vital area. Expanding the use of telemedicine, wearable devices, and mobile health apps to track fitness, mental well-being, and vital signs is especially useful for rural populations. This approach can bridge the gap and provide essential health services to those who need them most. Now let's take a look at the highlights of Men's Health Week 2025 activities. This week has been packed with insightful events, engaging activities, and impactful initiatives aimed at improving men's health across the board. Men's Health Week 2025 will feature several key initiatives. Wear Blue Day on Friday, June 13th will be a visual show of support. Community health camps will offer blood pressure, glucose, and cancer screenings. Additionally, there will be webinars and podcasts on stress management, parenting, and nutrition. The Global Blue Ribbon campaign on social media will use hashtags like #Men'sHealthWeek and #empathy4men. International Men's Health Week 2025 is more than a calendar event. It is, quite frankly, a moral imperative. To ignore men's health is to ignore the health of fathers, brothers, partners, colleagues, and communities. You know, when we talk about men's health, we're talking about the people who work in fields, drive ambulances, teach in schools, fight wars, build our homes, and raise our children. Closing the empathy gap means listening without judging, treating without stereotyping, supporting without shaming, and empowering without pity. Let us make 2025 the year we stand up for men's health, not in silence or secrecy, but with compassion, action, and care. Thank you so much for watching the video.